My name is LaRay Brown, and I'm the CEO or Chief Executive Officer of One Brooklyn Health. Across our system, our facilities have been in these communities for a total of 100 years. So we have a long tradition of serving Brooklyn residents. And what has been so remarkable about being a Power Fund grantee is the opportunity to have resources that were customized for where our organization was and is, and where me as the CEO of this organization, where I am in my development as a Chief Executive Officer. In addition, having the opportunity to interact with other leaders that were part of the Power Fund grantees group and the staff of Robin Hood has been very rewarding. Specifically for me, the Power Fund provided financial support for areas that I had thought that we needed some investment in as related to my board. So support through an advisor to help me discern how I could best support my board of directors. And frankly, the Robin Hood Foundation has been a strong support of One Brooklyn, the Power Fund, but we are also part of the work that the Robin Hood Foundation is doing as it relates to maternal and child health. And so being a Power Fund grantee and also being a grantee for a critically important programmatic issue and healthcare improvement issue has really been extraordinary. Being recognized as a grantee of the Power Fund in and of itself is an acknowledgement of a large, well-known foundation sense of the import of supporting leaders of color for all types of organizations. And I'm going to say unfortunately, because I am, I believe, the only CEO of a hospital system of color, woman of color, and I should say African-American woman to be even more precise, in New York. When someone said that to me, I was shocked because when I was told that for non-public hospitals that I was the first, I was committed to not being the last. And so having the recognition of the Robin Hood Foundation being, again, a member of the inaugural group of the Power Fund meant a lot to me personally, but also meant a lot for me in terms of the healthcare community, the hospital community. The idea is we serve people across all ethnic and racial groups, and we should make sure that people in leadership as well as the caregiving positions look like our patients and have and understand our patients in terms of culture and also lived experience. And so the Power Fund, in supporting me as a leader and enabling me to support a board of directors and my other staff, has just been immeasurable. Health is wealth. And so it is our mission to serve everyone in the communities of Central Brooklyn. But it is our not only our mission, but our responsibility to ensure that we are improving the health status of the communities that we serve. And if we can do that, we can have healthier communities, healthier people who then can be as productive as possible in terms of work, in terms of aspiring and achieving their economic goals, in educating their children, in supporting their families. Having employment in healthcare enables people to really make generational changes in their family's financial position. So we're both a provider of health and a supporter of the wealth and health of communities, but an employer, and in that way also contributing to the reduction of poverty in New York City.